Are you trying to get pregnant, or you're trying to avoid pregnancy, but you just can't tell when you're ovulating? In the next few minutes, I'll be able to show you how to spot some signs of ovulation. Hi guys, my name is Precious and I'm a registered nurse, and in my channel I talk about woman health and pregnancy. Now let's start with ovulation. What is ovulation? Ovulation is a process by which a matured egg is being released by an ovary, and this egg travels down to the fallopian tube waiting to be fertilized by a sperm. This usually happens around 12 to 16 days before your next period. The egg only survives 12 to 24 hours after it is being released from the ovary. Okay, and this is the only period when a woman can get pregnant. So let's dive into the signs of ovulation. Number one sign is a change in your cervical mucus. The cervical mucus is a discharge that is produced by the cervix, and it changes throughout your cycle depending on your hormones. So right after your menstruation or your period, you notice that your vagina is usually dry or slightly dry, or just little mucus actually. But as you approach ovulation, estrogen rises and your cervical mucus becomes more stretchy, slimy and clear, right? It looks more like an egg white, and when you pick it with your finger and then you stretch it, you notice that it is stretchy. It's not creamy, it's stretchy. Now this stretchy form of cervical mucus actually help the sperm travel easily to fertilize an egg. The second sign of ovulation is an increase in your basal body temperature. This is a temperature at rest. That is the temperature your body reads when it is at rest. This temperature is usually taken first thing in the morning before you even step out of your bed. You use your thermometer and then you dip it into your mouth, that's under your tongue, or you can also use it under your armpits, and then you test for your temperature. So before you ovulate, your temperature is usually low, but after ovulation, progesterone actually causes your temperature to increase by 0.5 degree to 1 degree Celsius. Okay, so taking your temperature every morning before stepping out of the bed will help tell when there's an increase in your normal body temperature. If you notice that it is above 1 degree Celsius, then it is probably not ovulation. It could be something else. Okay, but 0.5 to 1 degree Celsius will actually tell you that you've ovulated. So this cannot actually tell you that you're about to ovulate. It will only tell you that you've ovulated. So women that are quite confused about ovulating or not, like a lot of women don't know if they are ovulating or not, women like that will actually use this basal body temperature to tell if they are ovulating. But the good thing is that when you constantly keep tracking your temperature, with time you can actually tell when you are about to ovulate. Mismatch pain or ovulation pain is another sign of ovulation, although not every woman experiences this pain. Some women experience this pain on either side of their lower abdomen, either on the left or on the right. It is dependent on the ovary that is releasing an egg for the month. Okay, if it's the right ovary that is releasing an egg, you'll be feeling the pain on the right lower abdomen. If it's on the left, you'll be feeling the pain on the left lower abdomen. Not every woman actually experiences this pain, but a lot of women have confirmed to feel this ovulation pain. This pain can actually last a few minutes or a few hours, right? But it's actually an essential clue that you are ovulating. Another sign of ovulation is an increased libido. It is just the nature way of telling you that you need to procreate. Okay, so at this point you start feeling a high need for intimacy. Progesterone and estrogen are at work, and there is just a spike in your hormones. It's natural, but it's a sign actually. So when you start feeling that thing, just know that you are probably ovulating. Another sign of ovulation is tender breasts or sensitive nipples. Hormonal changes around ovulation can actually cause your nipple or your breast to become sensitive or tender. This is due to an increase in progesterone. Okay, although not every woman experiences tender breasts and sore nipple. This is similar to the kind of soreness some women feel during their period, but it is also a sign of ovulation. Another sign of ovulation is bloating. So a lot of women experience this bloating. You feel like you're so gassy, your stomach there's something heavy down there and you just can't tell, but you just keep gassing and gassing and gassing, it is a sign of ovulation. Ovulation sometimes can cause a light spotting, pink or brownish in color, and it can actually last for like a day. It's not serious, it's not intense, it's not harmful. It is just caused by hormonal change, that's the fluctuation of progesterone and estrogen, which actually causes the lining of the womb or the uterus to shed off a bit. Okay, and that's why you notice this light spotting. Not every woman actually experiences this too. Okay, so if you notice this light spotting that is not as heavy as a period flow, especially after you must have been done with your period, it is a sign of ovulation. Now, all the signs listed are not exactly 100% accurate. Okay, you might experience some of this and you might still not experience all of it. Some women don't experience all of it. Okay, but if you're experiencing at least most of it, you probably might be ovulating. But like I said earlier, it's not 100%. Okay, but if all the signs listed, you can't tell if you are experiencing all of it or most of it. Okay, you can actually use something called ovulation test kit. It's like a test strip that is dipped into your urine to test for an increase in luteinizing hormone, which is usually present 12 to 24 hours before your ovary releases an egg. So when you use this test strip and dip into your urine and then you test to see if there's an increase on this luteinizing hormone, and there is an increase, then that is absolutely your body telling you that you are about to release an egg. You can actually start this test few days before your ovulation and also few days after your ovulation. Okay, remember, every woman's body is unique. Okay, not every woman will experience all of these signs. You might experience some of them and you might not experience some of them, but that doesn't stop the fact or change the fact that you might be ovulating. Okay, and mind you, the only accurate or 100% sign to tell that you've ovulated is when you get pregnant. So pregnancy is the only sure sign to tell that you've ovulated, because you can't get pregnant if your ovary does not release an egg. The more you track, the better you get to know your body. If you found this video helpful, please hit the subscribe button, drop a thumbs up, drop a sign of ovulation that you've experienced that I probably did not mention here, and also please share my video out there. Okay, thank you so much for watching today's video. See you in my next one.